And we're back with Dr. Cynthia Snider. She's answering your questions about COVID-19 and how we can keep transmission low and whatever other question you have. All right, this first question is, should we delay getting boosted if I'm getting other vaccines at the same time? Now, they didn't tell me what other vaccines. I'm guessing it could be shingles or something of that nature.
So it really depends sometimes on which vaccines they're getting. Ideally, you can tolerate having different vaccines given at the same time as your COVID vaccine. So I think just checking with your primary care doctor which getting one, but ideally we don't want anybody to miss their regular vaccines that they're getting for non-COVID reasons. And this is actually also a really good time for the COVID booster vaccine.
Okay, well, on that note, because I have a question that asks, if I'm eligible for a booster, should I wait until fall when cases are expected to rise again, or should I get it now?
You know, that is a fantastic question. You know, I feel like that a lot of people are hoping that the vaccine is going to be reformulated. It really depends on the individual's risk factors. We still feel that if you are over 5 months out from your COVID vaccine, be it the first booster or finishing your series, you know, it's a great time to get your booster right now.
Okay. This next question is, should you test multiple times to confirm that you're positive or negative?
I would say in terms of, let's say you're symptomatic and you take a home antigen test and it's negative. It is good to repeat it in 24 hours or 48 hours or go to get a PCR test because the PCR test tends to be more sensitive. However, if you are symptomatic and that antigen test is positive, there's a good likelihood that that's correct. I hope that makes sense.
It does.
And then in terms of using the test to see if you have stopped shedding, you're no longer positive, that is a little bit more challenging because we feel like some people are still positive on day 6 and day 7 after their symptom onset. And even sometimes some people are still positive on day 10. So that's why it's exceptionally important to wear a mask when you're in public. And if you have the capacity to stay home to finish out your isolation for that 10-day period, that's fantastic.
All right, so this next question is about hospitalizations, especially at Cone. Do we have any numbers about who's making up hospitalizations right now that are COVID related, whether they're vaxxed or unvaxxed or?
Yeah, that's a great question. So we have right now just over like 40 people who are hospitalized throughout our whole health system. And at least half of which are folks who are unvaccinated. And then we have people who are under-vaccinated, I guess not completely up to date on their vaccine series. And I think the challenge too is that people who have multiple comorbidities, like any health problems that makes it for severe disease, especially patients who are immunocompromised, those tend to be the ones who get hospitalized. What we're seeing with this Omicron BA.2 or BA.2.12 subvariant is that it's predominantly an outpatient disease process. We're seeing people with colds, maybe a flu-like illness, but they're not necessarily meeting that criteria to be hospitalized, which is great. But the downside is that we know it's pretty infectious. So it's even more infectious than the Omicron BA.1 that we saw earlier in the year. So probably more household members are become positive. And so again, it's so important for people, like if they can quarantine at home after the exposure, that's fantastic. But especially if you know that you've been exposed, it's really important to be wearing a mask in public, especially in public transits and the workplace, anywhere where you think you're working in closed areas.
All right, well, this next question is kind of all about the whole contagious part of it. This person's asking, should I isolate after being in a large crowd as a precaution?
If that was posed to me, I would say I would continue masking in public and then testing anywhere in that, between day 3 and day 5 after your event to see if you may have contracted it from that exposure.
All right, and speaking of testing, of course, you can do the at-home testing, the antigen testing, or you can go get to the hospital or medical facility to get a PCR test, that kind of thing. This person's asking, can I get tested through Cone Health still?
Yes, there's still a couple sites that provide testing for patients and just the public, as well as other sites also include. I think some of the pharmacies do it. My own personal experience, though, I would want to make sure that you're getting swabbed properly. Sometimes people are self-swabbing and they're not doing enough of the sampling correctly, so that might lead to a false negative test.
For the at-home test is what you're talking about, yes?
Yes.
You got to follow those directions for sure, and make sure you get all the way up in there. It is uncomfortable. It should make your eyes water just a bit.
Correct. A little bit.
Okay. All right. We're going to take a quick break. We'll be right back with the last segment and with your questions.